Idaho Matters podcast is brought to you by St. Luke's On Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on demand care for common ailments such as a cough, sore throat, or a sinus issue. More information at stlukesonline.org. More Idaho Matters now from the studios of Boise State Public Radio News. I'm Gemma Gaudette. You know, falls can happen to anybody, but for older adults, injuries can actually be really serious, impacting both the health and the independence of our seniors. So that's why the Falls Prevention Coalition of Idaho is working to raise awareness, particularly as Fall Prevention Month gets underway. So joining us now is Erin Olson, Program Specialist and Coordinator of the Falls Prevention Coalition of Idaho. Erin, welcome to the program.
Thank you so much. I'm glad to be here.
So, Erin, can you tell us a little bit more about the Falls Prevention Coalition of Idaho and who you are?
Absolutely. Let's see, where do you start? The coalition was formally founded in 2003, but was actually started back in 2020. That was my first year as the program specialist and coordinator for the Idaho Commission on Aging's Health Promotions Program. And I learned that there was a National Falls Prevention Awareness Day, and I went, that sounds like something we should be involved in. So I started with that. That was very simple. But if you remember, that was also the first year of COVID. So another thing I
Mm,
was doing was meeting with a whole bunch of agencies about a whole bunch of things, trying to solve problems. And I learned that with all of those people working, we really weren't working together. We were working towards same or similar things, but not getting a whole lot of it done, or at least done well. I also realized that falls prevention was something that we really needed to address more widely, but that also couldn't be covered in a falls prevention day or even a week. So we've done a month. So with all of those things combined, wanting to alleviate some of the things that we'll talk about why preventing falls is important, it kind of
hmm
became my passion. And since 2000, we have been putting on the campaign every September. And in the process, I built the idea and brought together a group of interdisciplinary Idaho professionals. And here we are 5 years later with a strong nationally recognized coalition working on preventing falls for Idahoans.
So, what age group is most susceptible to falls?
The age group is interesting. I work for Idaho Commission on Aging, so we obviously work with people over age 60. 60 and 65 are a couple of different ways people group that. But we need to realize that falls happen for everybody. When we're a toddler and we first start taking those steps, we've all
hmm
had the videos about toddlers falling, and usually we just laugh and they get up and start over again. But when people get older, they of course have some challenges with flexibility, with strength, and so many worse things can happen when somebody falls. Those of course include, bruises and scrapes, but also broken bones, wrists, ankles, and most not importantly, but with a lot of prevalence, is a broken hip. Once somebody gets a broken hip, it really is a downward spiral, unfortunately, and they have negative outcomes for several years. So we do
hmm
focus at the Commission on Aging at people over age 60, but everybody falls, and falls are actually the number one cause of traumatic brain injury across all ages. So we want to protect younger people who are doing things and falling in the course of their daily activities, as well as older adults. We think of older adults simply because in some ways we think that the potential injuries and outcomes could be more negative for them.
So, is there a common cause for falls? Like, what are the most common causes?
Well, there's a couple of ways to look at that, of course. One is that you'll often hear them categorized as either a slip or a trip. A slip, of course, is usually environmental. I slipped on an icy step, where a trip is usually an obstacle. I tripped over the dog, or I tripped going off of a curb. Those are very
Mm,
common. With the coalition, kind of in trying to figure out our strategies, we identified four pillars that we try to address. One is ensuring that people are properly nourished and properly hydrated. It's hard to stay upright when you're dizzy because you don't have enough water in your system. The second is physical health, and that of course covers a whole bunch of things, including chronic diseases, things like diabetes, where if you have neuropathy in your feet, it of course is harder to feel those little things that you might trip over. And chronic pain is really big these days. We then take a look at emotional health, which primarily is depression, which, believe it or not, does increase a person's risk of falling, as well as something called the fear of falling cycle. And finally, of
Hmm.
course, is environmental safety, which is making sure that your home and your workplace and our public spaces are free from those trip and slip hazards.
So, Aaron, my understanding is that there are areas of our state where these accidents are happening actually at a higher rate. Can you talk to us a little bit about that?
Absolutely. There actually are. And it's interesting that the Department of Health and Welfare has identified that there are some counties that have a 5% or greater higher risk than the average of the rest of the Idaho counties. They include Bannock, Bingham, Bonneville, I got to remember my list, Elmore, Jerome, Kootenai, Shoshone, and Twin Falls counties. Now,
Hmm.
why is that? I'm not qualified to tell you that, but we do know that they are agricultural communities, they're rural communities. So, some of that may play into it, but falls are a multifactorial issue. So it's really hard to say exactly why they're higher in those areas.
So I want to talk next about how you can prevent a fall. If you could give us some tips on that, and this I think rolls right into that. If we can prevent this, this means that older adults can keep their independence longer.
How do we prevent falls again is very individualized, very personal to a lot of people, and addressing those kind of four pillars that we talked about. But we do have kind of a quick and simple generic checklist. One, of course, is to make sure that you have proper nourishment and hydration so that your body can be
Hmm.
strong, recover from potential slips and trips. The second with that is remaining physically active. We know that people who remain physically active experience far fewer falls because they have lower body strength, flexibility, and just overall general health is increased. An interesting one that I always like to point out that people don't even think about is wear properly fitting shoes. I know that I've been out in my garden wearing my Crocs that don't exactly fit the best, and all of a
Mm.
sudden I'm stepping out of them or flipping over the edge, and some of those things. So properly fitting shoes is really important, and especially for women. We know all of the issues women have with footwear. um, we do want to stay healthy. Get together with your doctor, treat your chronic conditions, check your medication list because many people are on more than three medications. And then we worry about something called polypharmacy, where one thing alone might be, lowering your blood pressure, for example. So when you stand up too fast, you get dizzy, but it also could be
Hmm.
an interaction. So check your medications every year. And I guess finally would be get your hearing and your vision checked. Vision makes sense. If I can't see something, I'm more likely to trip over it. But actually, any disability, including hearing and vision, more than doubles a person's risk of falling. So those are
And
some
you
things
have an
that anybody can do.
and you have an online seminar that's going to be happening tomorrow. Can you tell us a bit more about this?
And you bet. We actually have 6 online seminars coming up. The first one is tomorrow. It's called Preventing Falls is a Weighty Matter with Dr. Sean Simonson talking about weight bearing exercise. All of these are free. They are 1 hour. They are online, and anybody is welcome to come join us. We also talk about how caregivers can help their person they care for prevent falls. We're doing one this year on cognitive decline and falls prevention. And then we have an exercise one called Simple Steps, and even one by Habitat for Humanity that talks about how to identify and remove those trip hazards in your home.
And Aaron, how can people find out more information about the seminar? Like, how do they register?
That is very easy. The website is aging.idaho.gov/falls, FALLS. And they can find information and resources there, as well as register for any or all of the upcoming seminars.
Well, thank you so much for your time today, Erin. We've been speaking with Erin Olson, Program Specialist and Coordinator of the Falls Prevention Coalition of Idaho, about avoiding falls as well as it being Fall Prevention Month. You've been listening to Idaho Matters from Boise State Public Radio. I'm Gemma Gaudette.